Today, we are tackling a really important topic in maternal health, postpartum hemorrhage, or PPH. It's a leading cause of maternal mortality around the globe. But the key to managing and preventing it is really understanding it. So, let's get right into it.
So, here's our game plan. We've broken this down into 5 key parts to make it super clear. We'll start with what PPH actually is. Then we'll unpack its causes with a simple framework. After that, we'll look at how it's diagnosed, see how doctors race against the clock to manage it, and then we'll wrap up with some powerful strategies that can help prevent it from happening at all.
All right, let's start with the big picture. Why is postpartum hemorrhage such a huge concern for families and doctors everywhere? Well, the answer really lies in its massive global impact.
That statement just hits you, doesn't it? PPH isn't some rare thing. It's a major global threat to new moms. And that's exactly why every single healthcare system has to be ready for it, with quick recognition and an even quicker response.
So, what is it officially? Well, clinically, we're talking about primary PPH, and it's defined by a specific amount of blood loss. The alarm bells go off when a new mom loses more than 500 milliliters, that's about 2 cups, after a vaginal delivery. Or double that, a full 1,000 milliliters after a C-section. And that's all within the first 24 hours. Those numbers are the critical line that tells the medical team an emergency is happening.
Okay, so let's get to the real heart of it. Why does PPH even happen? In a high-stakes, time-crunch situation, clinicians need a fast way to figure out the cause. And for that, they use a simple but incredibly powerful memory tool.
It's called the 4 T's. And this little framework lets medical teams check things off systematically and super fast, making sure they don't miss a single potential cause. Honestly, understanding these 4 categories is the most important part of this whole explainer. So let's break them down.
And here they are, all in one place for a quick look: tone, trauma, tissue, and thrombin. Now, let's dive into each one so you know exactly what we're talking about.
First up is tone. This is all about what's called uterine atony. See, after birth, the uterus is supposed to clamp down hard, kind of like a clenched fist, to squeeze the blood vessels shut where the placenta used to be. But if it doesn't, if it stays soft and boggy, that's atony. And you gotta know, this is the #1 cause of PPH, by a long shot.
The second T is trauma. This is about physical damage that happens during birth. We're talking about tears in the cervix or vagina, or in some very rare and serious cases, a rupture of the uterus itself. So if the uterus feels firm but there's still heavy bleeding, trauma is a big suspect.
Our third T is tissue. This just means that little pieces of the placenta or membranes got left behind inside the uterus. Think about it. These leftover bits literally get in the way and stop the uterus from clamping down all the way. And if it can't contract, those blood vessels just keep on bleeding.
And finally, we have thrombin. This T is all about problems with the mom's blood clotting. This might be because of a condition she already had, like hemophilia, or a complication that popped up during pregnancy that messes with the body's amazing ability to form clots and stop bleeding.
So, a big question is, who's at a higher risk for this? Well, a few things really stand out. Having had PPH before is a huge predictor. Carrying twins or more stretches out the uterus, making it harder to contract. A really long or a super fast labor, an operative delivery like a C-section, or being anemic during pregnancy. All these things raise the risk. Knowing this ahead of time is a huge part of prevention.
Okay, so knowing the causes is half the battle. The other half is recognizing the emergency as it's happening. So how do medical teams actually spot PPH, and what's the diagnostic process look like?
Well, the most obvious sign, of course, is heavy, uncontrolled bleeding. But the body sends out other distress signals too. A racing heart and a drop in blood pressure are classic signs the body is trying to make up for that blood loss. If the person feels dizzy or their skin gets cold and clammy, that means things are getting more serious and the risk of shock is real.
So the diagnosis is basically a fast-paced clinical investigation. Doctors are estimating blood loss, constantly checking vital signs, and doing a hands-on exam to feel if the uterus is boggy, which points right to atony. They might use an ultrasound to quickly look for any retained tissue and rush some blood tests to check for anemia or clotting issues.
The second PPH is diagnosed, the response is immediate and systematic. It involves a whole team, and it is absolutely a race against the clock, where every single second counts.
The very first step is always to call for more help. This is not a one-person job. Then it's right back to the basics: airway, breathing, and circulation.
The team will quickly get 2 IVs going to push fluids and medication, give oxygen to support the body, and keep a super close eye on all the vital signs.
Once those basics are covered, the team moves right to direct intervention. This usually starts with a strong uterine massage from the outside to physically get it to contract. At the same time, oxytocin, the go-to drug, is given to chemically trigger contractions. If that's not enough, other drugs are added, and medications like canosamic acid are used to help the blood clot faster.
Now, if all of that still isn't enough, the team has to escalate to surgical options. They can insert a special balloon into the uterus to put pressure on the bleeding from the inside. That's called a tamponade. And in the absolute most severe, life-threatening cases, a hysterectomy might be the only option left to save the mother's life.
We've spent a lot of time on what to do in the emergency, but the best case scenario is always to prevent PPH from happening in the first place. And this is where proactive strategies can make a world of difference.
What you're looking at here is the global gold standard for prevention. It's called Active Management of the Third Stage of Labor, or AMTSL. It's a simple 3-step routine. Give a preventative shot of oxytocin, use gentle traction on the cord to help deliver the placenta, and then massage the uterus right after. It's one of the most effective tools we have, and it has seriously cut down PPH rates all over the world.
And of course, prevention doesn't just start in the delivery room. It starts way earlier. Identifying mothers with risk factors during their prenatal care is so important because it means the delivery team can be ready. And treating anemia during pregnancy is key. It ensures the mother has a healthier blood reserve and is just in better shape to handle childbirth.
So, we've seen how this powerful 4 T's framework helps everyone understand and manage PPH. And that brings us to a final question to think about. How can just being aware of this, knowing the 4 T's, help empower patients and doctors alike, and ultimately help make childbirth safer for absolutely everyone, everywhere?